Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers rural health and migrant health issues for RNs. By the end of this lesson, you should be able to compare and contrast definitions for rural health and urban health. You should be able to describe the health status of rural populations or selected health measures. You should be discussing access to service issues for rural underserved populations. You should be able to define what a migrant farm worker is and discuss common health problems of this subgroup and their families and barriers they experience when seeking health care. You need to be able to explain the nursing role for serving persons in rural communities, including migrant farm workers. Let's talk about rural health in rural environments, and then we'll talk about migrant farm workers. Rural health, rural environments are diverse and different from those in urban areas. The health status of the rural populations varies depending on the genetic, the social, the environmental, economic, and political factors that affect it. We know that the incidence of working poor in rural America is higher than in more populated areas. We know that rural adults 18 years and older are more poorer in health than those that live in the cities. We know that nearly 50% have been diagnosed with at least one major chronic condition. However, they average one less physician visit a year than healthier counterparts. So they're not going to the doctor as much, but they are suffering a little bit more. About 26% of rural families are below poverty level, so we know that poverty also plays a factor in that. More than 40% of all rural children younger than 18 years old live in poverty. Let's talk about migrant farm workers. A migrant farm worker is a laborer whose principal employment involves traveling from place to place, planting and harvesting products, and living in temporary housing conditions. This is a group of people that we need to be emphasizing on. Not all migrant farm workers are immigrants. It's different. I'm not talking about immigrants here. I'm talking about migrant people that are traveling from place to place. We do know that a majority of them may be immigrant. The Office of Migrant Health of the U.S. Public Health Service defines a migrant farm worker as a person whose principal employment is agriculture on a seasonal basis. So they go from place to place seeking employment. Okay, an estimated 3 to 5 million migrant farm workers are in the US. These numbers are controversial because of the inconsistency in defining whether they're farm workers or limitations in obtaining data from that. Before we talk about children of migrant farmers, I want to talk about that migrant farm workers are faced with uncertainties regarding work and housing, inadequate wages and safe working conditions, lack of enforcement regarding legislation for field sanitation, and safety regulations. So these are all areas that a nurse needs to be aware of. Farm workers are exposed not only to immediate effects in the fields, think about the fog and wet with pesticides, but also to unknown and long-term effects from being exposed to these pesticides. When harvesting is completed, the migrant farm worker becomes simultaneously homeless and unemployed. So, forced migration to find employment leaves little time or energy to seek out or improve their living standards or their health conditions. Many of them return to their country of origin after growing season ends. Migrant farm workers are found worldwide. An area of concern that nurses need to be aware of children of migrant farm workers. They may need to work for the family, sorry, for economic survival. Nurses need to consider the belief systems and lifestyles of rural population when assessing, planning, and implementing and evaluating community health services. So you really can't just judge them by what you believe. Barriers to rural healthcare include a lack of availability of the healthcare, affordability of the healthcare, accessibility of the healthcare, and acceptability of the services that are being offered. Partnerships can be formed and models can be used to make sure that we intervene. I've included some main points for you to consider when you are thinking about barriers to healthcare in migrant farm workers. Thank you for listening to this lesson. I hope you've enjoyed this quick overview of rural health in migrant health. If you have any questions and about the lesson or the corresponding notes, please feel free to email me. Have a lovely day.